lapel.
Polycystic Ovary Syndrome or PCOS. Hey everyone! Welcome back to our channel. Today, we're diving into an important health topic that affects many women around the world, Polycystic Ovary Syndrome, commonly known as PCOS. Whether you're experiencing symptoms or just curious about this condition, we've got you covered. So, let's get started. PCOS is a heterogeneous disorder, meaning it can present itself in various ways and affect individuals differently. It's primarily characterized by a combination of signs and symptoms related to hormonal imbalance, particularly androgen excess and ovarian dysfunction. So, let's start with the basics. PCOS is a hormonal disorder that affects women during their reproductive years. It's characterized by a combination of symptoms that arise from an imbalance in hormones, particularly androgens, which are often referred to as male hormones, but are present in women too, just in smaller amounts. In women with PCOS, there's often an excess of androgens. This can lead to symptoms like irregular menstrual cycles, weight gain, acne, and even excessive hair growth, known as hirsutism. But what causes these hormonal imbalances? The journey begins in the brain with the hypothalamus and pituitary gland. These two play a crucial role in regulating hormones in the body. In women with PCOS, there's often an increased secretion of luteinizing hormone, or LH, which can lead to increased production of androgens in the ovaries. Now, let's talk about the ovaries. In a normal menstrual cycle, the follicles in the ovaries respond to follicle-stimulating hormone, or FSH, which helps them mature. However, in PCOS, these follicles can become resistant to FSH, leading to a situation where they don't mature properly. This can result in the formation of cysts in the ovaries, hence the name polycystic. Now, what does this mean for women experiencing PCOS? Well, the symptoms can vary widely. Some common signs include irregular or missed periods, weight gain or difficulty losing weight, acne and oily skin, thinning hair or hair loss, hirsutism, which is the excessive growth of hair in areas like the face, chest, and back. To diagnose PCOS, healthcare providers often look at hormone levels through blood tests. They might check for elevated levels of testosterone and an abnormal LH to FSH ratio, which is typically greater than 3:1 in women with PCOS. So, what can be done about it? Treatment for PCOS often focuses on managing symptoms. Lifestyle changes like diet and exercise can be incredibly beneficial. In some cases, medications like birth control pills can help regulate menstrual cycles and reduce androgen levels. As we explained before, some of the most common clinical manifestations include irregular menstrual cycles, known as oligomenorrhea, subfertility, hirsutism, which is excessive hair growth, and acne. These symptoms can significantly impact a woman's quality of life, both physically and emotionally. PCOS has been recognized for quite some time. It was first described back in 1935 by American gynecologists Irving F. Stein and Michael L. Leventhal. Since then, it has been referred to by various names, such as polycystic ovary disease, functional ovarian hyperandrogenism, and even Stein-Leventhal syndrome. Now, let's talk about how common PCOS is. It's actually the most prevalent endocrine disorder among women of reproductive age. The prevalence can vary significantly depending on the population studied. For instance, in the United States, it affects about 4 to 12% of women, while in some regions of Nigeria, like Ilorin, it's reported to be as high as 12.2% and even 27.6% in Benin. PCOS typically affects premenopausal women, with symptoms often emerging around the time of their first menstrual cycle, known as menarche. Beyond the physical symptoms, PCOS is associated with various clinical, social, and psychological challenges. Now, you might be wondering, what causes PCOS? Well, the exact underlying cause remains unknown, but researchers suspect a genetic component. It may run in families, and some studies suggest an autosomal dominant inheritance pattern, meaning that if a first-degree male relative has symptoms, the risk may be higher for female relatives. Additionally, there's evidence pointing towards hormonal dysregulation. For example, a gene known as CYP11A is thought to play a role in the production of androgens, the male hormones that are often elevated in women with PCOS. There's also a connection with insulin resistance, which is common in many women with this syndrome. Some predisposing factors include a family history of PCOS, high maternal androgen levels, and even early onset of type 1 diabetes before menarche. Obesity and certain medications, like valproate, can also increase the risk. So, to sum it up, PCOS is a complex condition with a range of symptoms and potential causes. Understanding its introduction and etiology is crucial for managing the condition effectively. Next, let's dive deep into a condition that affects many women worldwide, Polycystic Ovary Syndrome, or PCOS for short. Let's start with the pathophysiology of PCOS. Now, don't worry if you're not familiar with the term. Pathophysiology simply refers to how a disease develops and affects the body. In PCOS, the underlying cause is not entirely understood, but researchers believe it involves a combination of genetic and hormonal factors. One key player in this condition is insulin. Many women with PCOS experience insulin resistance, which means their bodies don't respond well to insulin, a hormone that helps regulate blood sugar. This resistance can lead to higher insulin levels in the blood, which in turn stimulates the ovaries to produce more androgens. These are male hormones like testosterone. Now, elevated levels of androgens can disrupt the normal menstrual cycle. Typically, the ovaries release an egg during ovulation each month. However, in PCOS, this process can be irregular or even absent, leading to what we call oligomenorrhea, fewer menstrual periods, or even anovulation, where no egg is released at all. This hormonal imbalance can also lead to some of the more visible symptoms of PCOS. So, let's talk about those clinical features. Women with PCOS may experience hirsutism, which is excessive hair growth in areas where men typically grow hair, like the face, chest, and back. This happens because of those elevated androgen levels we just mentioned. Another common symptom is acne. The increased androgen levels can lead to oily skin and breakouts. Plus, some women might experience androgenic alopecia, which is thinning hair on the scalp. Now, let's not forget about menstrual dysfunction. Many women with PCOS have irregular periods, which can make it difficult to conceive. In fact, infertility is a significant concern for those affected by this syndrome. And it doesn't stop there. PCOS is also associated with other health issues, such as obesity, insulin resistance, and even metabolic syndrome. This syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. Lastly, some women with PCOS may develop acanthosis nigricans, which is characterized by dark, velvety patches of skin, often found in areas like the neck and armpits. One key player in this condition is insulin. Many women with PCOS experience insulin resistance, which means their bodies don't respond well to insulin, a hormone that helps regulate blood sugar. This resistance can lead to higher insulin levels in the blood, which in turn stimulates the ovaries to produce more androgens. These are male hormones like testosterone. Now, elevated levels of androgens can disrupt the normal menstrual cycle. Typically, the ovaries release an egg during ovulation each month. However, in PCOS, this process can be irregular or even absent, leading to what we call oligomenorrhea, fewer menstrual periods, or even anovulation, where no egg is released at all. This hormonal imbalance can also lead to some of the more visible symptoms of PCOS. So, let's talk about those clinical features. Women with PCOS may experience hirsutism, which is excessive hair growth in areas where men typically grow hair, like the face, chest, and back. This happens because of those elevated androgen levels we just mentioned. Another common symptom is acne. The increased androgen levels can lead to oily skin and breakouts. Plus, some women might experience androgenic alopecia, which is thinning hair on the scalp. Now, let's not forget about menstrual dysfunction. Many women with PCOS have irregular periods, which can make it difficult to conceive. In fact, Infertility is a significant concern for those affected by this syndrome. And it doesn't stop there. PCOS is also associated with other health issues, such as obesity, insulin resistance, and even metabolic syndrome. This syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. Some women with PCOS may develop acanthosis nigricans, which is characterized by dark, velvety patches of skin, often found in areas like the neck and armpits. So what is the PCOS differential diagnosis? This is the process of distinguishing PCOS from other conditions that can present similar symptoms. Women with PCOS might experience irregular menstrual cycles, excess hair growth, or acne, symptoms that can overlap with several other disorders. Some of these include hyperthyroidism and hypothyroidism. Both can affect menstrual cycles and hormone levels. Hyperprolactinemia, elevated prolactin can lead to irregular periods and other hormonal imbalances. Hypogonadotropic hypogonadism. This condition involves low hormone levels affecting ovulation. Primary ovarian failure. Here, the ovaries stop functioning properly before age 40. Acromegaly, a rare condition caused by excess growth hormone, which can also disrupt menstrual cycles. Late-onset congenital adrenal hyperplasia. This condition leads to excess androgen production. Androgen-secreting tumors. Tumors in the ovaries or adrenal glands can produce high levels of androgens. Cushing's syndrome. This disorder results from excess cortisol and can cause similar symptoms. Exogenous androgen use. This refers to taking androgens for bodybuilding or other purposes. Now, let's move on to investigations. Diagnosing PCOS involves a combination of clinical evaluations, laboratory tests, and imaging studies. Biochemical tests. Doctors typically check hormone levels, including FSH, LH, total and free testosterone, and prolactin. They might also assess blood sugar levels and lipid profiles to evaluate insulin resistance. Radiological tests. An ultrasound scan is commonly used to check for the presence of polycystic ovaries, while CT and MRI scans may be utilized in specific cases. Histology. An endometrial biopsy can help rule out other conditions affecting the uterus. Next, let's discuss treatment options. Managing PCOS is highly individualized and depends on the woman's specific symptoms and goals. 1. Conservative management. For those with mild symptoms, lifestyle changes like weight loss, dietary modifications, and regular exercise can be beneficial. Regular monitoring for conditions like diabetes and dyslipidemia is also important. 2. Medical management. This often includes hormonal treatments. Combined oral contraceptive pills can help regulate menstrual cycles and lower androgen levels. For those who cannot take these, cyclic progestogens or intrauterine devices may be alternatives. Insulin sensitizers. Medications like metformin can improve insulin sensitivity and help restore ovulation. Fertility treatments. For women seeking to conceive, options include clomiphene citrate or assisted reproductive technologies. 3. Treatment for hirsutism and acne. This can involve hormonal treatments, anti-androgens, and various topical medications. 4. Alternative medicine. Some women find relief through acupuncture or supplements like myo-inositol, which can help regulate menstrual cycles and improve insulin sensitivity. 5. Surgical options. In rare cases, surgical interventions like laparoscopic ovarian drilling may be considered for women who do not respond to medication. Finally, let's talk about complications that can arise from PCOS. Short-term complications can include obesity and insulin resistance, leading to diabetes, irregular menses and infertility, hirsutism and acne, which can significantly impact quality of life. Long-term complications may involve increased risk of endometrial cancer due to prolonged exposure to unopposed estrogen, cardiovascular diseases and hypertension, abnormal lipid levels and depression. Understanding these potential complications is vital for both patients and healthcare providers to ensure comprehensive care. PCOS is a complex disorder that requires a multifaceted approach for diagnosis and treatment. If you or someone you know is experiencing symptoms of PCOS, it's important to consult with a healthcare professional for a thorough evaluation and personalized management plan. Thanks for tuning in to today's video. If you found this information helpful, don't forget to like, subscribe, and share it with someone who might benefit from it. And as always, feel free to leave your questions or experiences in the comments below. Until next time, take care.
Pharma Pal.